My name is Tatyana Kushner. I'm a hepatologist and I practice in New York City at a large academic health center. I treat many patients with viral hepatitis, including patients with delta hepatitis. Hepatitis delta, or HDV, is a blood-borne viral infection, which means that it's transmitted from one person to another through contact with someone's blood who is infected with delta hepatitis. It's very closely connected with hepatitis B because in order to be infected with delta hepatitis, you need to have underlying hepatitis B. Interestingly, the delta hepatitis virus uses components of the hepatitis B to work. Very critically, hepatitis delta is the most severe form of viral hepatitis with the most rapid progression of disease compared to other forms of viral hepatitis, such as hepatitis B alone or hepatitis C. The symptoms of HBV and HDV are somewhat similar, although may differ in individual patients. So in viral hepatitis, during acute infection, it is possible for patients to experience relatively nonspecific symptoms, such as fatigue, not feeling well, general discomfort. However, it is also important to recognize that many times patients with hepatitis B and or delta hepatitis are asymptomatic. That means they actually do not have symptoms either at time of infection or later in the course of infection. It is really important to test for HDV in patients who already have hepatitis B, in particular if they were never tested for HDV before. There are still significant barriers that exist today for screening and diagnosis of HDV. First, the most important barrier is really the lack of awareness and the lack of education around HDV. As a result, many providers are not aware of what HDV is and who to actually test for HDV. People with HDV specifically often face significant barriers to care, and among those barriers are the stigma associated with hepatitis delta, and efforts such as World Hepatitis Day are really important in order to combat the stigma associated with the disease so that the stigma does not interfere with patients seeking the care that they need. Patients should feel empowered to ask the important questions about their liver disease when speaking with their doctor. First, they should make sure that they are tested for delta hepatitis, and so they should ask their doctor about whether they were tested for delta hepatitis if they are living with hepatitis B. If they have a diagnosis of delta hepatitis, patients should ask their doctor and speak to their doctors about how advanced is their liver disease currently and what can they expect about future prognosis. If I could send one message to doctors treating viral hepatitis, it is to screen all patients with hepatitis B for delta hepatitis. We see patients who are in their 30s and 40s who already have advanced liver disease. So people should be aware of the rapid disease progression associated with delta hepatitis and refer patients to treatment early. For someone who has just been diagnosed with viral hepatitis, I spent some time speaking to them about what it means to have viral hepatitis. A key message that I share with patients is that we are in this together, that we can work together in order to manage their disease, and we will do everything possible to decrease the risk of progression so that they can lead normal, healthy lives.